Good day. I am Dr. Marc Lester F. Quintana, and I'm here to present a research output that is very timely because this coincides in the celebration of the International AIDS Candlelight Memorial held every third Sunday of May every year. The International AIDS Candlelight Memorial is a time for us to remember the many lives lost to AIDS. It is an opportunity to honor those who dedicated their lives to helping people living with and affected by HIV and continue to mobilize our communities in solidarity. Please allow me to present a research output entitled Leadership Initiative to Enrich the HIV/AIDS Education for Senior High Schools of Laguna, Local Colleges and Universities. For the introduction, leadership refers to the set of skills and ability to motivate and inspire others. It is usually associated with power, according to Dugan and Comives in 2010. The chance to become a leader, according to Dugan in 2011, depends upon the person's accessibility to resources, their social status, roles, and genuine fears for safety or negative consequences. According to Mortensen in 2014, becoming involved as early as possible for students in their teens prepare them to be future adult leaders. It hones them to initiate, make, and execute plans. With this, according to the same authors, the teens tend to view leadership not a status achievement, but as an inclusive opportunity available to anyone with the goal of improving their community. According to Trowler in 2012, leadership activities improve outcomes for students in a range of areas, and one of them is in their academic performance. By engaging in these activities, students learn to become confident, articulate, and responsible. As our chart in 2013 said, providing these students with opportunities to develop their leadership skills prepares them for future leadership roles. The question is, what happens if these future leaders who are in their stage of life where changes, discoveries, search for identity, and autonomy permits them to become infected with HIV and AIDS? They will be intimidated and fearful, making their hands clutch to take tests and examinations in determining the presence of absence of the virus in their body. Here is the data at a glance and the fast facts of HIV epidemic in the Philippines. Currently, we have 85,651 HIV AIDS cases since 1984 to present. We have 34 new cases every day in 2021. And by 2022, the number of cases is projected to be 158,437. Calabarzon, our region, is second among the regions with the highest HIV reactive cases in the country. And about 2 in every 3 new HIV infections is occurring among 15 to 24 years old, our youth. As the teen immune system worsens, variety of complication can soon arise like serious progressive illnesses that confronts a range of psychological challenges including the prospect of real and anticipated losses, worsening quality of life, the fear of physical decline and death, and coping with uncertainty. People will see them as lesser persons and are at times devalued. They may become withdrawn, aggressive, and rude to colleagues and friends. This may be because the infected person may feel being victimized. These teens can experience a decline in self-esteem as they are no longer confident in themselves of what they can achieve. This is likely caused by the stigma within society against infected and affected people, which causes detrimental effects to the person's well-being. Their precarious living conditions and social vulnerability can generate major family upheavals, like becoming quiet and isolated, in denial as to their HIV positive status, and remaining restricted as to whom shall know it. Their behavior, according to Fernet, in 2011, were associated with fear of prejudice, rejection, and social isolation. Therefore, according to Richard, they must confront their fear and denial, and they must cope with being effective while maintaining hope. Looking through the situation above, the need of identifying solutions and lessening the scope of the problem is very vital. The researcher believed that intensive HIV/AIDS education is a crucial part of efforts to fill the gap between the existing problems and decreasing the number of new cases, especially among the youth. With this belief, the researcher spearheaded the conduct of an action research entitled Awareness Among Senior High School Students of Laguna University Towards Knowledge on HIV/AIDS Transmission Prevention and Protection. Based on its findings, the researcher developed the InnoHive program, the innovative HIV education that is composed of different HIV/AIDS awareness activities such as the InnoHive Symposium, the InnoHive Intensive Focused Series of Lectures, the InnoHive Focus Group Discussion with counseling, testing, and referral services, and lastly, the InnoHive Film Showing Strategy. This program helped the senior high school students and the teachers at Laguna University in terms of better dissemination of knowledge and information about HIV/AIDS using various techniques and strategies that makes teaching and learning about HIV/AIDS effective. The success of researchers' InnoHive program at Laguna University motivated him to pursue this present study. This time, his aim would be is to present and implement the InnoHive program to other local colleges and universities in Laguna. This is to help enrich the HIV/AIDS education among the senior high school students in Laguna and transform them to become leaders before they make major life choices. Part of his motivation was also to educate the youth to reduce the risk of HIV infection by enabling them to defend their sexual and reproductive rights. With more intensive health education, these students will be more likely to know how HIV/AIDS is transmitted and prevented. The InnoHive program will help them how to become empowered leaders and how to voice out their concerns, to be able for them to touch the hearts and minds of other young people, as well as the community and the government. Their actions, in turn, can lead to ratification and implementation of law against sexual abuse of children, against premature and forced marriage, and against sexual violence and coercion within and outside marriage. A harmonious environment will be created from the courage of these teen leaders wherein discussion of HIV/AIDS will not done in secret and shame, but publicly and with concern. The teens' leadership will mean making sure that every young person in every neighborhood will be prepared with the details about the HIV and AIDS and how to prevent it and has access to the services, skills, and support needed to develop safe behaviors from the start and to spread the message. For the research objectives and scope of the study, this study was conducted to present and implement the InnoHive program to the local colleges and universities in Laguna to help enrich the HIV/AIDS education among the senior high school students and transform them to become leaders before they make major life choices. This will empower them to assert their sexual and reproductive rights using intensive health education. It will also help them how to become empowered leaders and how to voice out their concerns, to be able for them to touch the hearts and minds of the other young people as well as the community and the government. For the methodology, this study utilized the sequential explanatory mix method research design to determine the degree to which the InnoHive program, a leadership initiative, can enrich the HIV/AIDS education of the senior high schools of Laguna local colleges and universities. Data were gathered utilizing a research-made questionnaire which was validated. The results were analyzed using statistical package for the social sciences, a program for statistical analysis. For the results of the study, for problem number 1, what is the level of knowledge on HIV/AIDS of senior high school student respondents in terms of transmission, prevention, and protection? The legend. For level of knowledge on HIV/AIDS of senior high school student respondents in terms of transmission, the overall mean score is 3.03 with a verbal interpretation of high level of knowledge. For level of knowledge on HIV/AIDS of senior high school student respondents in terms of prevention, the overall mean score is 3.13 with a verbal interpretation of high level of knowledge. For level of knowledge of HIV/AIDS of senior high school student respondents in terms of protection, the overall mean score is 2.88 with a verbal interpretation of high level of knowledge. For problem number 2, what is the level of awareness of senior high school student respondents about the effects of HIV/AIDS in terms of the physical aspect, psychological aspect, socioeconomic aspect, and spiritual aspect? The legend. For level of awareness of senior high school students about the effects of HIV/AIDS in terms of the physical aspect, the overall mean score is 3.01 with a verbal interpretation of high level of awareness. In terms of the psychological aspect, the overall mean score is 3.15 with a verbal interpretation of high level of awareness. In terms of the socioeconomic aspect, the overall mean score is 2.93 with a verbal interpretation of high level of awareness. And lastly, for the level of awareness of senior high school about the effects of HIV/AIDS in terms of the spiritual aspect, the overall mean score is 3.07 with a verbal interpretation of high level of awareness. Problem number 3, what is the current state of HIV/AIDS education in Laguna local colleges and universities vis-a-vis senior high school curriculum? The legend. The current state of HIV/AIDS education in Laguna local colleges and universities vis-a-vis senior high school curriculum, the overall mean score is 1.84 with a verbal interpretation of low current state of HIV/AIDS education. Problem number 4, what are the strengths, weaknesses, opportunities, and challenges of the current senior high school curriculum of Laguna local college and universities vis-a-vis HIV/AIDS education? The legend. The strength of the current senior high school curriculum of Laguna local colleges and universities vis-a-vis HIV/AIDS education yielded an overall mean score of 2.20, which is low. For the weaknesses, the overall mean score is 2.53, which is high. For the opportunities of current senior high school curriculum of Laguna local colleges and universities, the overall mean score is 2.88, which is high. And lastly, the challenges of the current senior high school curriculum of Laguna local colleges and universities vis-a-vis HIV/AIDS education yielded an overall mean score of 2.88, which is high.
Let's go to conclusion, limitation, and recommendation. For the conclusion, this study therefore concludes that knowledge and information about HIV/AIDS can be disseminated clearly using various techniques and strategies that will make the teaching and learning about HIV/AIDS inculcated to the minds of the very young readers, the senior high school students, who the study found to have high levels of knowledge about HIV/AIDS in terms of transmission, prevention, and protection. They also have high levels of awareness about the effects of HIV/AIDS in terms of physical, psychological, socioeconomic, and spiritual aspects. In terms of the current state of HIV/AIDS education in Laguna local colleges and universities, vis-a-vis senior high school curriculum, it was found to be low. However, there is a high status of opportunity and challenges for the current senior high school curriculum of the Laguna State local colleges and university vis-a-vis their HIV/AIDS education. So this will help them in pursuing to increase their low status of strength and high status of weakness. For the limitations and future research, findings of this study must be treated with caution and may vary in other areas of the Philippines. This is because the study only included population of senior high school students at selected local colleges and universities in Laguna. Although the data collected were approved by the schools, this study was based on self-report of the senior high school students. So this study had the options of not to complete the survey questionnaire, but given that they were asked by the teachers and given time to complete the survey while in the school, some may have felt uncomfortable leaving school without completing the survey. For the recommendation, this study recommends that senior high school students must become more knowledgeable and aware about HIV/AIDS. So they have to be more conscious on what level they understand and know about HIV/AIDS, as these are the key steps in making decisions about their health, and be transformed in terms of the attributes and becoming leaders, become knowledgeable, aware, and informed, advocating about HIV/AIDS in terms of prevention and protection to every young person in the community. So the parents of senior high school students must also become more open and willing to tackle questions about HIV/AIDS, education, and discuss it freely with their children. For the school administration, they have to raise their knowledge and awareness, specifically on HIV/AIDS of their senior high school students. And lastly, for educators and peer counselors, to acknowledge the additional facts from previous researchers that may be verified in the study, so it will be beneficial to the practitioner in their functions as healthcare providers, educators, and counselors. That would be all. Thank you so much.